cloud technology for as long as I've been there, which is 10 years. We have outsourced what I say are 5 of our mission critical applications. They include Epic, which is our electronic health record, Lawson, which is our HR and ERM system, our GE billing system, and our HealthQuest billing system. So those are all outsourced, those are all cloud providers. Well, I can't say whether it's on the rise or not. In my small world, in talking with the CISOs that I'm aware of, they are not considering cloud technology or what I would consider the Googles and Microsofts for electronic health records. They would consider outsourcing to a third party, which is a cloud, but they're not considering any of the Google, Microsoft, Amazon for protected health information. One of the reasons is we're just not sure where that data is going to reside. And one of the things that we always ask for is that our data be on our own server. And those types of cloud providers can't do that, so, or won't do that. So, but if you're looking at other aspects of the business world, certainly we can look at mail, we can look at other applications that we have that could go out to a cloud. Sure, and we'll be more than happy to work with the business unit. We just need to understand what the business objective is. The business needs to understand what the risk is, and then they have to accept the risk of doing that business on the cloud. From my perspective, no. Because in my dealings with some of the business associates that we have, they're not really sure what their roles and responsibilities are when it comes to protecting our patient data. So it's more of an education process for me to educate them on what their roles and responsibilities are. So it really depends on the vendor, but for the most part, I don't treat it any differently than I did before. You need to understand what the business objective is even before you start talking to the vendors. So talk with the business, understand what they want to see out of the cloud. A lot of businesses don't know what cloud means. They're just looking for faster, cheaper, but they don't understand what the risk is. So make sure that the business understands the risk. When you begin to discuss the cloud vendors, have a list of questions that you want to ask them. Do some research on the web of a particular cloud vendor to make sure that even before you get to that point, they meet your criteria. Well, first of all, you should have your own. Even before you should have your own business associates agreement ready. Okay. Your legal team should have it for whatever vendor it is. Really, you should not change your business associates agreement for any reason unless it's negotiated by the legal team and then reviewed by the privacy officer. So you should have your own formatted business associate agreement. The vendor comes in and says you need to sign our business associates agreement. That's when we should say, no, here's ours, you're going to sign ours. And that's when the negotiation process takes place. My objective is to protect my institution and to protect my patients. Their objective is to protect their institution. So somehow we can come to a negotiation or a collaboration. If we can't do that, then we as an institution need to be willing to walk away.